Hey everyone, I'm Dr. Ben. In this video, we're going to talk about what you can do to help your child with picky eating. As a quick disclaimer, if your child has any developmental delays and you are not sure if this advice is safe to follow, please check with your pediatrician. Picky eating is common, but thankfully generally improves as kids grow older and usually does not cause long-term health issues. Importantly, picky eating is rarely the parent's fault, so if your child is a picky eater, you should not feel guilty or blame yourself. With some effort and time, this will likely get better. So take a deep breath and relax. In the rest of this video, we will go through some strategies you can use to help your child with picky eating. Picky eating may take weeks or even months to improve, and this is okay. So be patient while you work on this with your child. Importantly, keep mealtime as stress-free as possible. Remember, eating is a skill, and it will be easier for your child to improve their eating habits if they enjoy the eating experience. Children may not enjoy mealtime if they are in an uncomfortable position. They often find it easiest to eat when they are seated with their hips, knees, and ankles at 90 degrees, using a chair strap, booster seat, and footrest if needed. There are expensive seats you can purchase for this, or you can work with what you have. Couch cushions, boxes, and other household objects can go a long way. A wobble cushion may be helpful if your child is very fidgety. Additionally, remove any distractions during mealtime, in particular electronic screens. Many children only accept new foods after several exposures, possibly requiring 15 or more attempts, so do not give up after only a few tries. Rather, keep offering some variation of the same food a few times a week. Track this by keeping a list with 3 columns to remember which foods your child always eats, sometimes eats, and has not accepted yet. Use this list to record how often you try variations of the food and move them over when your child more strongly accepts them. As a caregiver, you need to model for your child what you want them to do. They will not know that new food is safe to eat unless they see you eat it. So, eat the food together and make sure you seem to enjoy it. You can even let your child feed the food to you, and they may be more willing to accept it in return. Most children should receive 3 meals and 2 to 3 snacks a day. These can be short and should generally not go longer than 15 to 30 minutes. Consider purchasing a sand timer for mealtime so your child will see how much time is left. They can leave before time is up if they at least try something new, or they can choose to not eat and stay the full meal. Try to separate meals and snacks by 2 to 3 hours. You can see one example eating schedule on the screen. You should adjust this to work with your own family schedule, but try to keep some type of routine for your child. Children can drink water between meals and snacks, but should not eat or drink otherwise, meaning no grazing on foods or having other drinks before eating, as children need to be hungry when it is time to eat to try a new food. You can pause the video to read juice and milk recommendations on the screen, but to be clear, children usually do not need more than 2 cups of milk a day and do not need any juice or other sugary beverages at all. The Ellyn division of responsibility is widely promoted and goes like this. It is the parent's responsibility to determine what foods are available, where they are served, and when they are served. Thus, as a caregiver, you determine the overall meal structure and what foods are present. However, it is the child's responsibility to determine for each food if they want to eat it and how much they will eat. This means you should not pressure your child to eat their food. It is their choice if they want to eat or not. What if your child is not hungry and chooses not to eat anything? That is okay. It is normal for younger children to have good and bad days of eating. When they do not eat the provided food, do not offer an alternative. They will learn what hunger feels like and may eat more next time. You also do not have to throw away the food. You can put it in the refrigerator and take it out later. Regarding what to provide in meals and snacks, make sure to include at least one food your child likes to help reduce anxiety and stress. And do not provide too many new options, as this may overwhelm your child. Otherwise, try to offer different food groups, textures, and flavors while offering somewhere between 3 and 6 foods. You can combine foods, or you can provide them separately on a plate. If your child does not like foods to touch each other, consider using section plates, but beware that some kids have trouble progressing to non-section plates over time. You can instead put the new food in a small container on the main plate, or serve it separately as a learning food. If this still causes a lot of stress, consider offering the new food at a special snack time to try the taste so you can keep mealtime stress-free. If your child does not try it, you can still discuss it. Speaking of discussion, be careful with your language about food. Try to keep things as positive as possible and never say something tastes bad. In fact, try to avoid using words like yummy or yucky and stick to more concrete descriptions of foods and how they help us when we eat them. For example, you can describe a slice of a banana as a yellow circle that feels mushy and has fiber that helps us poop. When possible, serve the whole family the same meal while including at least one of your child's preferred foods. Importantly, do not offer portions that are too big. Too much of a new food may be scary, while too much of a preferred food may fill up your child before they try a new food. I'm including a link in the description discussing portion sizes, and I am showing examples for toddlers on the screen. To be clear, this full plate would be way too much food. This just shows several examples. A healthy snack may include 3 of these options, such as half of a slice of bread covered with a thin layer of cheese and half of a piece of fruit. When you are providing repeat exposures of foods, you can alter them to increase variety. If possible, consider adjusting the temperature, color, texture, or shape. Small children may find skinny food pieces about the length of your pinky finger easiest to hold and eat. You can alter the flavor by adding herbs or spices, such as cinnamon, and you may even try adding Parmesan cheese or sprinkles. You can also pair a new food with a preferred food, and as your child gets used to the new food, you can increase the amount that you offer over time. Help your child become more comfortable with food by including them in shopping, cooking, and potentially even gardening. If you cannot take your child shopping, you can still give them options to choose from online. Then, let your child handle the foods in a safe manner when preparing them, as many children are more willing to eat food they help prepare. Children often want to explore foods with all their senses to develop comfort with eating them, so do not discourage this or say it is bad manners. In fact, children are more likely to repeat behaviors you pay attention to, so, when safe, it can be best to ignore negative behaviors. You also do not need to clean up any mess until after the meal is over. Constantly wiping your child's face during a meal can be irritating and make the experience less enjoyable. However, you do not need to tolerate all behaviors. For example, I'm including a link in the description that discusses what to do if your child is throwing food. If needed, consider using positive reinforcement, where you praise or reward positive behavior while ignoring negative behavior. When you first offer a food, you can offer a small reward to your child if they give it a try. This reward should not be food itself. Rather, it can be a sticker, a star, or something else meaningful to your child. I would only provide rewards the first few times when trying a food, and not after your child has already refused the food. Otherwise, your child may learn to expect rewards and refuse foods if they are not given. Another method you can use is kiss, lick, bite, swallow. Start by touching or kissing a food with your mouth and ask your child to do the same. When they do this, praise them. After a few exposures, move on to licking the food, then biting the food, and then finally swallowing it. You can also start with very small pieces of food and increase the portion size over time. If your child gets anxious or fearful at mealtime, you can introduce food play away from the table to make food interaction more fun. Make sure you do this separately from meal or snack time so your child does not see it as a reward for refusing to eat. If your child has sensory issues and still does not want to even touch the food, it may be helpful to put it in Ziploc bags or to have your child wear plastic or rubber gloves to help them develop comfort with handling food. Once your child likes at least one type of food, you can usually modify it to increase variety. Food chaining is a technique that takes this to the next level, where you end up converting one food into another. As examples, you can convert potato chips to bananas, chicken nuggets to grilled or baked fish, and macaroni and cheese to broccoli. If needed, you can use some of the other techniques we have discussed to help your child move from one step to the next. Probably close to 5% of children have severe picky eating with underlying medical or developmental issues that will make it difficult to successfully treat this by yourself. If you think this may apply to you, or if the tips in this video are not helping after several months, please discuss with your pediatrician. Your pediatrician may refer you to a specialist and can also determine if your child will benefit from a nutritional supplement. I hope some of these tips and strategies are helpful when you work with your own child. You can also look in the description of this video for links to additional resources. Remember, be patient, keep things stress-free, and keep trying. Most children will respond well when given enough time. If at any point you feel you are not making progress or your child is not growing well, check with your pediatrician to see what other steps you should take. Anyways, I hope you found this video informative, and I will see you in the next one. Goodbye.